Hi Felix, how are you?
Hi Liz, I'm not doing so good. Actually, I think I might be getting sick.
That's awful. What's wrong?
Yeah, it is. I've been coughing a lot and feeling very dizzy since last night. I also have some chest pain. I feel terrible.
That doesn't sound good. Maybe you should go see a doctor.
You're right. I might go this afternoon. Oh, I didn't ask. How are you?
Well, 2 days ago I got this really bad toothache and it doesn't go away. My gums are red and swollen and I feel pain when I drink or eat.
You must be in a lot of pain. I'm sorry to hear that. Why don't you call your dentist?
I already called her. I have an appointment this afternoon.
Great. Call me later and let me know how you feel, okay?
I will, thanks. Keep me updated on your situation too.
Good morning. What is your name? How can I help you?
Hello, Iza Morales. My name is Liss. I have a really bad toothache. It started hurting 2 days ago, and it's getting worse. I might have a big cavity or a broken tooth. My gums are red and swollen, and I feel pain when I eat or drink, especially with hot or cold foods.
Have you had problems like this before?
Not really, but sometimes my teeth felt sensitive.
That could mean you have an infection or gum inflammation. Let me check. Okay. Yes, you have a big cavity and your gums are swollen. The cavity is quite deep, so we must do an X-ray to see how bad it is.
Will it hurt?
Don't worry, I will be use anesthesia, so you won't feel anything during the process. The X-ray will help us to see the cavity has reached the nerve. I will clean your area and feel the cavity. Don't worry.
That sounds scary. What happens if I don't get treated?
If you leave it untreated, you could lose the tooth. You might also feel more pain and swelling.
I understand. What do I need to do after the treatment?
First, you must take an antibiotic for the infection and a painkiller if you feel discomfort. Also, avoid very hot or cold foods for a few days.
Is there anything else I should do?
Yes, you might also rinse your mouth with warm salt and water to help reduce swelling. And don't eat too many sugary foods because they can cause more cavities. If the pain doesn't go away, you must come back for another checkup.
All right. Thank you, doctor. I will follow your advice.
Hi, I'm Dr. Iza. I'll be treating you. Tell me, how are you feeling today?
Hi, Dr. Isa. I'm not feeling well. I've been coughing a lot and feeling dizzy since last night. I also have some chest pain when I breathe deeply.
I see. Have you had a fever or trouble breathing?
No fever, but I do feel a little short of breath sometimes.
Have you had this kind of cough before?
Not really. I had a cold a few weeks ago, but I felt better after a few days. This time it feels worse.
Alright, let me listen to your breathing. Your chest sounds a bit tight. You might have a respiratory infection or a mild bronchitis. So I would like to do an X-ray to check out if it's nothing serious.
That sounds a little scary. Will the X-ray hurt?
No, not at all. It's just a quick scan to see what's going on inside. But in the meantime, I will prescribe some cough syrup, and for the chest pain, I will prescribe some painkillers. If the symptoms persist, you might need an inhaler to help you breathe better.
Okay. That makes sense. Do I need to take any other precautions?
Yes, you need to rest, to drink plenty of fluids, and avoid cold air or strong smells that could trigger more coughing. Also, if your symptoms don't go away in a few days, you might need to come to check again.
Got it. Thank you, doctor.
You're welcome. Take care and get some rest. I'll be sending the X-ray results via email, and if it's necessary, my secretary will be getting in touch with you to make an appointment. Goodbye.
Hey, how are you feeling now?
So much better, the doctor was right. Resting, drinking lots of fluids, and taking the cough syrup really helped. My chest doesn't feel as tight anymore, and I am not coughing a lot. How about you?
That's great. I'm feeling much better too. At first, I was nervous about the treatment, but the dentist did an amazing job. The pain is gone, and my gums aren't swollen anymore. I have been avoiding sugary foods and using the saltwater rinse like the doctor said.
That's awesome. It's crazy how much better we feel just by following their advice.
I know, right? Honestly, I was scared it would hurt. But the whole process was easier than I expected.
Same here. I thought my cough would last forever, but the medicine worked fast. It's a good reminder that we shouldn't wait too long before we see a doctor.
Definitely. Lesson learned. Take care of ourselves and listen to the experts.
Agreed. Now, time to enjoy feeling normal again.